The Food and Drug Administration is hearing a lot of criticism from state and federal lawmakers over the approved drug Zohydro. My next guest has labeled the painkiller dangerous and capable of fueling addiction in the U.S. West Virginia Senator Joe Manchin joins me now. He has introduced legislation to withdraw the FDA's approval of this new drug. Senator, thanks very much for joining us. I wanted to also point out what the FDA says in response, but first to you on why you think this drug is so dangerous.
Well, let me just say, Andrea, first of all, thanks for having me, but this is such an important issue for all Americans. It's an epidemic proportion as far as prescription drug abuse. In West Virginia, it's the leading killer. When I was a governor of the state of West Virginia, I saw firsthand what it was doing in devastating families all over my state. And one little girl, about 12 years of age, her daddy got hurt in the mines, and she said before we knew it, he was addicted, and we lost everything. And basically what we're trying to do is bring this attention. It took me over 3 years since I've been a senator just to get hydrocodone rescheduled, and it's not even finished yet, rescheduled from a Schedule 3 to Schedule 2, which will give us more control over this drug and how large quantities is being dispersed out and really hold doctors more accountable. That's of hydrocodone contents in the drug. Now, even before that schedule has gone from a Schedule 3 to Schedule 2, FDA, Andrea, comes out with Zohydro, which is 10 times more lethal than the hydrocodone prescription drugs we have on the market. And then on top of that, they had a recommendation from their experts, their field of experts, that 11-2 they recommended, their advisory committee, not to bring this drug on the market, and they did it anyway.
Well, in response, the FDA says that this is a unique niche. It fills a purpose for pain control, and that it has less liver damage toxicity than some of the other drugs that are available. So that their argument is that it's very necessary for those patients who need it, and that it's not solely the FDA's job to deal with abuse of prescription drugs. Their job is to approve drugs that are needed for pain control by those patients who need it.
Andrea, let's talk about the process of approving. If you have the experts, leading experts in the country that tell you this is such a lethal, two pills taken at one time can kill a human being. 2 pills, and it can be used in many different forms. They have different makeups and compositions of this pill coming out that could basically protect the public. But no, they go ahead and do this one. And let me tell you the thing that really has gotten me fired up is that we know there's a thing that I've defined as pay to play. That there is drug companies paying a couple of universities $25,000 to $35,000 directly, paying these universities for the chance to sit down in a private setting with the FDA with no oversight, no transparency whatsoever. And we know that Zohydro came through that type of a process. Now, there's something wrong with that, and we're going to look into it. We're not going to stop until we get to the bottom.
In fairness, I just want to give you what the FDA responded to us with today, which is that the agency is still reviewing Senator Manchin's proposal, but believes that a piecemeal approach, including targeting products intended for patients in pain, is not the answer. We look forward to continuing to work with Congress on preserving access to medications for patients suffering from pain while addressing a serious public health problem, the inappropriate use of opioids, which is the category of drug.
As a United States Senator representing the great people of the state of West Virginia and worried about people all over this country, I can't even get responses, okay? It takes such a long time to get any response from them. They're so slow. I'm going to get to the bottom of it. I'm going to have other senators involved. I'm talking to the Health Committee, to the Judiciary Committee, to Pat Leahy and to Tom Harkin. And Tom has been very much concerned about this, and I appreciate it so much. There's something wrong when you go against the Advisory Council. I'm sure they made the same pitch to their advisory council, which recommended 11-2 against bringing this deadly, lethal drug on the market. And someone's got to talk and speak up for the people, basically, that are addicted. We have, in West Virginia, it is the #1 killer, is hydrocodone. This is pure hydrocodone. It's not mixed with anything. And they're telling me because of the labeling, and then the liver effects it would have, and there's other things coming on the market that is better protected. This, in a raw form, Andrea, you can't even basically protect the people that are addicted, that'll crush this and use it in the most lethal way. And it's just awful what we're putting on the market. We are the most addicted society in the world. We use more prescription drugs than anybody. And they keep bringing on more lethal drugs of this kind, and it just makes no sense. And I know with all the news that's going on in the world today, but this is the #1 killer in my state. And for me to sit by and watch this happen and bring on more drugs in defiance of what we just said, listen, it's taken us 3 years to get you to recognize. In your own advisory committee that I presented my reasons for going Schedule 3 to Schedule 2 to all hydrocodone, Andrea, they voted 19-10 to agree with me. And then it took another year for the FDA even to react, and we had to shame them into it by getting all these other committees involved. So don't tell me that they're reacting to the public's desire or protection of the public. I don't believe so. And if pay to play, if that's what's driving them bringing these drugs to the market, we need to put a stop to it.
Well, they have strongly denied that, but we will get to the bottom of it, and we'll have you back, and we'll have Dr. Hamburg here, we hope, and others to fully debate this as we continue. Thank you very much, Senator.
Thank you for